Could you tell us anything about what you were just doing in the meeting?
We're trying to get health insurance reform bill passed, and it's very controversial, as you know, and people have very strong feelings about it on both sides, as you know. But here's the deal. Some of us believe we all pay too much for health care, and health care costs continue to rise at an alarming rate. I talked to a small business guy who owns a sign shop up in my district, and in Ashland, and he said to me that he was about to hire somebody, and he got his insurance bill and went up 21%. Well, I'm not hiring anybody new now. I want to work longer hours, I'll be away from my family more, but this is nuts. And you know, businesses and individuals and cities and towns that provide insurance to their employees are seeing the costs go up and up and up. And in spite of all that we spend on health care, and in spite of the fact that it consumes 16% of our economy, it will probably be 50% in about 40 years, but in spite of all that, Cuba has a better infant mortality rate than we do. And our life expectancy, on average, ranks behind Bosnia. I think for all the money we're spending, you know, we should live to 100, 200. I mean, it's just, you know. So what we're trying to do is figure out a way to deal with all this. And
yes.
one of the things we believe is that you need to get everybody insured. We have 45 million Americans without insurance, and that costs a lot of money because you have insurance, but if you're in Texas and you don't have insurance and you get sick, you go to the hospital anyway, you get treated anyway. It costs to pay the nurses and the doctors in the room. So, and guess what? It all goes on. You pay it in the form of taxes, or it goes on to our debt, and you pay the interest on the debt. There are people around the country who can afford insurance who just don't get it because they don't have to. You're all required to have car insurance. You ought to be required to have health insurance. In Massachusetts, we have a mandate. We all have to have it. But in some other states, you know, you could be a middle-income businessman who's 25 years old or 30 years old, and they ask you, do you want us to provide you health care, or do you want the money? Well, you're 25 or 30, I'm going to live forever, I'll take the money. If you go on a camping trip and get bit by a tick and get Lyme disease, and, you know, you're going to get treated. But the deal is that we will all pay for that, so that's not fair. The other thing is, we think that, and I should also say, the poorest of the poor in this country get Medicaid. So it's, people we're talking about are people too rich to qualify for Medicaid, but they're also people who are really fairly well off, who just choose not to do it. And so the other thing is we're trying to figure out a way to have more competition. Because I think the more competition, you figure the prices will start to level out and won't rise as much. The other thing is passing a law that says insurance companies cannot discriminate against you because of a pre-existing condition. And we've had cases of people who were discriminated against and not given insurance because they had a bad case of acne. We've had people, we had a woman who came in here from Maryland who had in vitro fertilization and had 2 kids, and went to, and her husband lost her job, and they're trying to get reinsured, and they said because she couldn't conceive naturally, that's a pre-existing condition. I mean, there's all these wacky stories about people who are, so what we're saying is insurance companies cannot do that. You know, they can't discriminate against you because of that. And that, that we should encourage prevention. My grandmother used to say to me, your grandmother probably said to you, an apple a day keeps the doctor away. Unfortunately, she's right. I mean, we do a lousy job of prevention here. So eliminate all the co-pays for wellness visits and for colonoscopies or mammograms or things like that to encourage people to get treated. I mean, there's some disease like colon cancer, for example, that no one should ever die from. People die, people don't get checked. A lot of people don't get checked because of the cost. So we're trying to get that into this mix as well. You know, and it's very controversial. People are yelling and screaming on both sides about it. I think it's the right thing to do. I think we'll save some money down the long run, in the long run. And, you know, save money is you keep people well. And so we're trying, it's a whole realignment. And we may vote on it as early as next week. So I'm on two committees that are relevant in this. One is the budget committee, which now we're scheduled to meet on Monday, which means I have to fly back early on Monday. And we're going to have an 11-hour to 12-hour meeting, we're told. And then I'm on the rules committee, which is like the traffic cop of Congress. All bills go through the rules committee. We decide how it can be amended. Sometimes we change the text. So that it goes to our committee. That'll be another mega meeting on Wednesday. And then perhaps we'll vote on this on Thursday. So that's where we are.
Is it looking good?
I'd say it's about 50-50 right now. Yeah, so who knows?
I mean, in terms of healthcare